Good morning, everybody. Thank you all for joining us here today. Lots of exciting new milestones in the fight of COVID-19. Certainly in America and in Louisville and Kentucky, we've got positive momentum on our side. We still have got a ways to go to get to the finish line, but it looks much better now than it did months and months ago. All that being said, you're seeing lots of problems all across the rest of the world. Our vaccination rates are certainly much higher here in America, but we've got to stay humble to this virus because we've seen it do very unpredictable things before. But right now, the data is showing that we're in a much better place. Big announcements this last week, two of them in particular. Pfizer announcing the vaccine can be administered to 12 to 15-year-olds. So we're seeing that already. That's great news. And then, of course, the big news last week was the CDC new guidance on mask, meaning that individuals who are fully vaccinated need to stop wearing the mask in most, if not all, situations. People were surprised at how quickly that announcement came about in terms of lack of notice, but I don't think there's any one perfect way to make an announcement like that. So we're working through it like we have on everything else. Governor Fischer has announced he will lift the mask mandate and most other restrictions in Kentucky here on June the 11th. But we also understand the decisions had led to some questions and confusion in the transitional period between phases of fighting the disease. And so we got a panel of experts from our hospital systems that we'll hear more from in a moment that can give us some advice on that. And in this time, we've got to realize, too, that our businesses have been through a very difficult period with the pandemic. And now, as things are opening up, we got new challenges as well. And they're trying to figure out how to respond to the new guidelines. Our economy is definitely starting to pick up. And as people get out more, it's important to help our businesses protect their employees, their staff, and their customers. So if they have a mask wearing policy, please just put your mask on as you go into the store or restaurant, wherever it might be. So it's a good idea to continue to carry a mask with you. And for folks that are wondering what to do, first question to ask is, have you been vaccinated? Right. So that is the best solution to everything, is to go ahead and get vaccinated. You're seeing some news, especially with the New York Yankees, about people being vaccinated and getting the disease, but a much milder form. It hasn't killed anybody that's been vaccinated, and some of these type of activities were expected. So message is the same. Getting vaccinated will simplify your life and the lives of the people that you interact with each and every day. There is no, there is no question that we got plenty of supply. And you'll remember just as little as a month or two ago, that was always the key issue. So plenty of supply of the vaccine, and vaccines are safe. They work against the virus. They're working against all the variants that we know of as well. So it's the way to go. We got to recognize still that there is some hesitancy vaccinating the first 2/3 of the population that more or less wanted the vaccine versus the latter third, or 25% that don't necessarily run to it. We knew that was going to be more difficult, and that's the stage that we're in right now. And for folks that are just unsure about what to do, ask somebody that you trust. Ask your healthcare provider, just somebody that you believe has the information where they can share that with you. And we understand people are going to be coming at this from a different angle, but the best way to keep yourself safe and your family safe is certainly to get the vaccine. Okay. So right now, we're going to talk to somebody that I trust and people across our city trust, and she's led us through her period of COVID-19 and other health emergencies before, and that, of course, is Dr. Sarah Moyer. Dr. Moyer is our Chief Health Strategist for the city and also runs our Department of Public Health and Wellness. She's going to run us through our current data. Dr. Moyer?
Thanks, Mayor. So yeah, been a very exciting week. A lot of great announcements between kids 12 and up being able to get vaccinated now, and then the research coming out that it is safe if you are fully vaccinated to not being wearing a mask. That said, we are still in the orange here in Jefferson County. And if Chris can pull that up, you'll see that right at 10 right now, 542 cases added, and 176 deaths were added to our total last week. If you see there on the graph, only about 13 were added in the last month, but 176 throughout the year, finally getting caught up on that backlog and the audit from the state. So 176 did not pass away last week, but it's still high. I mean, a lot of deaths still in May right now. So another reminder that the world is starting to get set up for those of us who are vaccinated. And you see those guidelines changing from the CDC to the state guidelines. Thank you, Chris, for pulling that up. But you'll see here that in Jefferson County, only 38.7% of our residents are fully vaccinated. That is less than half. Those numbers are increasing still. We went up for the third week in a row last week with over 11,000 new people getting their first shot. And so grateful for that. But just a reminder that if you are choosing to not wear your mask when you go into crowded indoor places, just know that 4 out of every 10 people are fully vaccinated, and so majority of people in Jefferson County are not. So I know I'm personally still wearing a mask when I don't know the status of those people around us, and recommend everyone else does the same. So you'll see here too with the maps where in our community have higher rates of vaccination. Those darker greens have over 50%. The graph on the left are fully vaccinated. The lighter is 20 to 40. So something else to keep in mind, what part of town you're in, what percentage of people might be fully vaccinated. If you can scroll down again, Chris. So hospitalizations continuing to remain steady in that lower rate. And as far as we know, all of our hospitalized and death cases are not fully vaccinated. So if you do not want to be one of those statistics, just another motivating factor to please sign up to get vaccinated today. Going down to the demographics, our cases continue to be the highest in that 20 to 44-year-old age group, as well as the 0 to 19. And that is consistent with the groups of people who are vaccinated. So Chris, if you could scroll down to the vaccination demographics. You'll see there, we've changed that graph for the patient vaccinated by age group. You see that our 70 to 74-year-olds have the highest percent vaccinated with over 90%. But if you go down to that 20 to 44-year-old, less than 20% there. So depending around the age of people that you were around, you now have a better idea of who's vaccinated and not. We still have more females than males vaccinated in our community, so something to keep in mind as well too there. And so with that, just knowing that event exposures are still the #1 things that people state when we ask maybe what they were exposed to. And these are small gatherings and parties like derby parties, as well as proms and birthday parties, weddings, and those sorts of events. So please, if you're not vaccinated and you are going to these things, especially unmasked, please make sure you're getting tested afterwards. And just another reminder that the world is changing. Guidelines and mandates are changing on the assumption that people are or will get vaccinated. You say the governor gave us a few weeks leadway, so those of us that are not vaccinated can sign up today to get vaccinated. But that time is getting shorter. So just please, vaccines.gov is a great place to look if you are not vaccinated. You can also text get vaxxed, your zip code to get vax. That's GETVAX. And you can immediately receive addresses at nearby vaccination centers. There are also going to be pilots with Uber and Lyft to get you there as well if transportation's an issue. So really working hard to try to remove all the barriers that are out there. I think one more point I just want to make, Mayor, before I turn it back over to you, is that we, along with case count staying steady in that orange range, we also had a record number of variants of concerns reported last week. That B117 is still the majority of cases, but also seeing an increase in our P1 and the B1429 cases across our city. Over 2/3 of the cases now in Kentucky are variants of concern. And so just if you get COVID now, it's probably one of the variants. which we know causes more hospitalization and morbidity in our younger populations. And so just another reason to get vaccinated, as long with reminding you that if you're fully vaccinated, you do not have to get screened for testing, only need to get tested if you have symptoms. You also get out of quarantine if you're exposed to somebody who's positive. Besides that, protecting yourself, protecting your family and friends, and not having to wear a mask, all those reasons, hoping that everyone chooses to get vaccinated today. So that's it. Thanks, Mayor, and I'll be here for questions.
Thank you, Dr. Moyer. I know we sound like a broken record on here, but because it is the answer to get vaccinated, so we'll keep explaining that. So let's now talk about our 12 to 15-year-olds. So that was a big announcement this past week about their eligibility to receive the Pfizer vaccine. So let's go deep into that, and then after we speak about that, we're going to talk about the CDC's changing recommendations for people who have been vaccinated relative to masking guidance. So we've got three great resources with us today, been frequent contributors to this segment here every week, which we appreciate. We have Dr. Joe Flynn, the Chief Administrative Officer of the Norton Medical Group and the Physician-in-Chief at the Norton Cancer Institute. We have Dr. Jason Smith, who's the Chief Medical Officer at U of L Health, and Dr. Chuck Anderson is the Chief Medical Officer at Baptist Health. So welcome to each of you. I'll throw a few questions at the group, and you all work together enough now that we can just have a conversation about what's going on. So let's just start with focusing on our 12 to 15-year-olds. So with the FDA and CDC expanded authorization on Pfizer, how are you all adjusting your hospital systems to start getting these younger citizens into your places? Jason, I'll just throw it to you, kick it off.
Yeah, I'll be happy to start, and I think Dr. Flynn probably has more for Norton Children's and the like, but what we're doing right now is moving through all of, or trying to move through most of our testing locations. The one area that we are not giving the 12 and over is the mass vaccination site, and that is simply because we're going to be closing that big site down at the end of the week, but we are doing that at our Brook and Liberty sites, and we're also getting this out to our urgent cares, as well as most of our practice locations. And I'll have information, I hope, by Monday of next week to share with everyone about where those locations are going to be at, and getting it out into the community. And I think that's really the next step that we need to take is get this out into pediatricians' offices and doctors' offices and urgent cares and pharmacies, and make it as easy as possible for people to go to the providers they trust to get the vaccine. And I think we've shown people want to hear from their doctors. They want to hear from the people that have been giving them care for a long period of time. And that's what we want to provide to all those patients.
Thank you. Dr. Flynn?
Yeah, I'll just tag on. So I think that the first point Dr. Smith made, or the last point, is really important, that of all the things that are compelling to patients, over half of patients or individuals listen to their physicians and take that information accordingly and will respond to that. So we really need, as a community, to make sure we rely on those resources. As far as how we're looking at the age 12 to 15, I think everyone knows 16 and 17 we've been utilizing for Pfizer since the first EUA was granted. And so we have a lot of processes in place to allow for that. What we've done specifically is at Novak Center, at the Norton Children's Medical Center, certainly at the Whitney Young Center, where we're working with Humana and the JCPS, St. Matthews, West Broadway location, all of our locations, we've expanded to the 12 to 15. We're also working with some of the schools and businesses to try to do either family functions or getting this age group to the schools to get vaccinated. I think we'll see over the course of, as we're heading into the summer months, it's really important that people, before they let their kids get into the summer vacations, to get vaccinated. And certainly there'll be another push as we head into the summer and head towards the new school year to do more of the same.
Very good. Dr. Anderson.
Both of those about making the access easier. We opened up our drive-through to the 12-year-olds last Friday. We had a nice uptick related to that. We're just trying to go to the community as we can. We're not doing that quite as well as we could possibly, but anyone can drive up through our drive-through with their 12-year-old and up, and hopefully parents and children, and we'll get them vaccinated from that standpoint.
And then what, Dr. Anderson, what kind of detail or data do you share when people are saying, is this safe for my kid? I mean, that's always been a question, but now that we're down to 12-year-olds, what do you tell them?
Yeah, just the same thing, that all of this has been through the proper precautions. I was seeing some patients today and it caused me to be on a tad late, and I had this discussion earlier. It's the same thing, that this was rushed through. This was not done right. This was done within 9 months. And then I just try to explain how Operation Warp Speed cut through the red tape. All of the same steps were taken. All the same steps were taken for the 12 to 15-year-old. That nothing was shortened. I tell them, even though my children are older, both of them have had it. We got nieces and nephews that have received it as well. And I just try to reiterate, as Dr. Flynn mentioned a while ago, that the physician is recommending it, and we feel comfortable with the way it's been approved.
Mm-hmm. And Dr. Flynn, I think there's some confusion that like the mRNA vaccine between Pfizer and Moderna, it's like it just started 9 months ago. But you might want to just review how long that particular vaccine approach has been under study.
Yeah, the mRNA vaccine approach in general is really something that's revolutionized vaccines. And we've looked at it for an array of diseases, everything from cancer to other viral illnesses. And it's been studied for really decades. And it is safe. If you look at the data that was used by the FDA to approve or put forward the EUA for 12 to 15, in my career, I've not seen more compelling data for a drug that's new to a group. I think if people need more compelling information, I think if you listen to Dr. Moyer's comments and look at the data that she presented, you see a direct response to those not vaccinated and those who are getting admitted with illness. And that to me is the most scary thing that we can see. So the vaccines are extraordinarily safe. We have a lot of experience in this arena. Certainly to tag on to Dr. Anderson's point, yes, it went fast, but understand that we had a lot of patients that went on studies very quickly. Normally, the rate limiting step is getting people to participate in studies. And we were able to really ramp that up as a nation, really internationally, but certainly as a nation. And that's why we're in the position we're in today. It's the normal things we've used for drug development were followed to the T. And I think that's what's really important. And I'm a father of 4, and I will say here, for everyone here, every one of my kids is immunized. I've looked at the data painstakingly, and there's nothing that I've seen that would keep me from doing that or recommending it to anybody that I love.
Yeah. Dr. Smith, I've seen you out in the city quite a bit at the different vaccination sites. Are you seeing anything in particular that convinces people that have concerns to finally say, okay, I'm going to get vaccinated?
I think it's talking through this questions that they have with someone they trust. And I don't think you can put a price on being able to have those discussions with your doctor, your providers, or a doctor or someone you know or have seen. I think a lot of the questions that I have when we're going around, a lot of people come up and will ask the questions you've asked today. Is the mRNA vaccine safe? The answer is yes. It's been around for 20, 30 years now. The impetus was always, how do you handle it? Because it's actually it's probably the best way of delivering a vaccine. It's just difficult to handle, which is what we see with the ultra cold storage and stuff. And so this disease said, well, you know what, if this is the best way of doing it, we're going to figure out the logistics to handle it that way. The other thing we always say is that seeing your friends and your family, people within your community, get vaccinated, do well with it, talk about how it made them feel safer, how it made them feel less anxious about everything that's going on in and around the country. That's an important message. And that's an important thing that I think people don't talk enough about. We've been living with this dread on our shoulders and around us for, a year and a half now. And you can often see after people get vaccinated, they feel different. They feel safer. It's a bit of a freeing feeling. And it's, to be honest, going around the city and doing this has been one of the best parts about everything that I've had to do. And I think most of the physicians on here will say the same thing, is getting out and being able to deliver this care has just been phenomenal for I think all of the healthcare systems and interacting with the community that way.
Well, and we've seen some phenomenal responses of people that have gotten the vaccine from, tears of joy, to your point earlier. It's just, And I know when I got mine, it's like, man, I feel like a ton was lifted off my shoulders because I was always kind of looking over my shoulder, waiting for the virus, to come and get you. And it's been really gratifying to see the results of the work that you all have done in the community. So certainly appreciate that. Let's switch over to the new mask mandates now. So Dr. Moore, do you want to kind of give us a summary of the new mandates, and we'll have a discussion with our visiting physicians here on them?
Sure. So the governor came out with new mandate Friday of last week, still requiring masks in high-risk settings like healthcare, corrections, long-term care facilities, childcare, daycare, schools, homeless shelters, and I probably missed one there. But then besides that, if you're vaccinated, there's no mandate outside of that. That said, the state health department is still recommending local health departments recommend wearing masks in cities where vaccination rate is not high. And so that is majority of our county here. And still, so me personally still wearing a mask in indoor crowded places like retail, venues, those sorts of places, but knowing that I have that extra layer of protection to make you feel safe, and that the research shows that if you do get exposed to COVID, it'll if anything, it'll be mild, not going to end up in the hospital, or with worse outcomes. So just a lot of really great news about how amazing these vaccines are. And I think that's really exciting.
Yeah. And Dr. Anderson, how'd you react when you heard that? I think it was last Thursday, wasn't it? That they're like, oh my gosh, this is moving too fast, or what kind of reaction do you have, and what kind of advice?
I kept my mask close by. Kind of like Dr. Moyer, I felt good about it. As Jason said, it's a weight lifted that maybe we're getting over that bump. But I guess what scares me is that we're going to be in a retail area with a bunch of people not wearing masks, and how many of them are not vaccinated. And that not necessarily for my protection, but for the two folks who are not vaccinated, because they're going to be the person who gets sick. We have several folks in our units right now. Thank goodness the numbers are way down. But guess what? They're in the 40s. Just what Dr. Moyer said a while ago, the more critical ill are the people in the 40s. I don't know their vaccination status, but they're the group that we're going to be worried about. They're going to say, hey, the mask mandate is lifted. If someone asks me, yeah, I'm vaccinated, but they're really not, and they're putting themselves at risk. That part scares me, not necessarily for myself, but for the other folks that we try to take care of.
Yeah. So Dr. Flynn, this is probably an unfair question, but I'll ask anyway. So how do you see this working out? I mean, because we are concerned about people that are going to be saying, yeah, I got vaccinated, but they're not. And so do you see the virus eventually dying out, or do you see like a mini surge within that cohort, or how do you think this is all going to resolve itself?
Yeah, I think we'll just learn from past episodes. When people get together and they're not masking and they're in close quarters, we see a spike in COVID. There's two things, and Dr. Moyer was alluding to it in her dual comments around the vaccines are effective, but the masking is very effective. I, like her, will be wearing my mask in clouded when I go to the store in other areas, in part for two reasons. One is I don't know what everyone else has going on, but also as a show of support for them to say it's okay to still mask. There's other things you can catch, by the way, as you're out there, other viruses that we need to be cognizant of. And so yeah, it's a tricky thing. I'm afraid, though, that with people, the idea to wear a mask is not a punishment. It's really designed to help people, to keep people alive. I think everyone on this call, we've seen way too many people die, too many people with long-term effects. You look at some of the effects in young people now, long-term. Look at some of the professional athletes that had COVID, and they're using inhalers before they work out, and their lives have changed. So it is important to still mask up. Get vaccinated, but if you're not, wear your mask. It's very important for you and your families.
Mm-hmm. And Dr. Smith, Dr. Flynn just mentioned there's been a impact on non-COVID diseases because of the mask wearing. What any summary you can provide for us on that?
Well, I think it's a testament. I mean, look at the number of flu cases we had this year. It was almost non-existent. And it was related to the fact that, people were social distancing, people were wearing masks, people were staying out of large gatherings, they're washing their hands more frequently. All the things that we have been preaching long for a long period of time about containing illnesses and viruses and colds and everything, it turns out it's true. And it's kind of funny. I remind people that, it's not that the flu went away, it's that people started actually doing all the things that we've been recommending for a long period of time. I do think, I will say that in the subpopulation that does not have a vaccine, we will see COVID run through that population at some point in time. I don't think there's any way not to. It is too widespread. It is going to become an endemic disease within our population. Once this epidemic is over, it will be with us forever. And so the question becomes is how do we manage that going forward? How do we protect ourselves and protect our families and our communities? Because I agree with what Dr. Flynn said. One of the things that we struggle with all day long with these younger patients is the number of people that have some long-term debilitating problems after an acute COVID infection. We don't talk about it as much because the deaths were really what people were focused on. But there are not an insignificant number of people that have, symptoms months after developing COVID. And I think that's something that people need to be very, very careful of. And the vaccine will protect you and your children from that. And so, it is the easiest, best, and fastest way for you to protect your family. That's what I remind everyone. And there's lots of opportunities for you to be able to get that vaccine across the city.
All right, we appreciate that. If you guys could hang with us here, we'll be having some questions from the media for you in a second. But one final note before we take those questions, and that is the University of Louisville's Christina Lee Brown Environmental Institute and the Co-Immunity Project have also been outstanding allies in the fight against COVID-19. And they're still working to understand the impact of the virus in Jefferson County and the relationship between tests in individuals and the wastewater testing that they have underway. So they need about 1,000 more Louisville residents to participate in community testing for COVID-19 and antibodies going on now through Monday, May the 23rd. And also, it doesn't matter whether you've been vaccinated or not. Their testing is free. It's a quick drive-up test. They'll even give you a $10 gift card for participating. So for more information or to sign up, the contact info is on their screen. Chris, if you could throw that up there, you can go to their website or you can call 833-313-0502. And you can see the rather long website, louisville.edu/environment/the community project. So please consider helping them out. As we move closer and closer to getting to community immunity here, we'll be relying on our wastewater detection even more to help us understand what parts of the city still have higher evidence or penetration of the virus, so we can swarm those neighborhoods with even more explanation, understanding, and vaccination options also. So with that, let's move to our media questions. Jess, if you want to take it from here.
Thanks, Mayor. The first question in the chat is for the doctors. The question comes from David Mattingly with Wave 3 News. He says, a recent survey found that people who are not vaccinated are roughly twice as likely than their vaccinated counterparts to be maskless in public. He asks, does this defeat the purpose of relaxing mask mandates? And Dr. Moyer, if you want to start, and then if any of the other doctors have anything to add, that'd be great.
So I think that's one of the big fears of relaxing the mask mandate. You heard, I think all of us share our opinion on that, and most of us will be wearing masks in crowded places just to set that example and show that it's still needed, because we don't know who's vaccinated and who's not. You can look at the data on our website and just get a better idea, but in general, about 4 in 10 people are fully vaccinated. So expect 6 out of about half, more than half, when you're going out to the grocery store or other places, should be wearing a mask still. And so just hope that people continue to do that until we get vaccination numbers up in our city.
Okay, the next question is for Dr. Smith. It comes from Lawrence Smith with WDRB News. He says, can you talk about the reasons for closing the Cardinal Stadium site and the best strategy going forward for getting people vaccinated?
Yeah, sure. So the Cardinal Stadium site was always going to be about a 7-week run to try and get as many people vaccinated as possible. So we're not really closing it early. We're just completing that 7-week period of time that we started back in early parts of April. For best strategy, I think every one of the healthcare systems represented on this call and beyond have got appointments availability on their websites at multiple different locations still to get the vaccine. So just because the mass vaccination site is closing doesn't mean we don't all have drive-up opportunities, physicians' offices, urgent cares. There's plenty of places still within this city to get the vaccine. And I don't think it's a stretch to say there's probably more availability right now than there ever has been across a greater geographic area of our community in order to get a vaccine.
Thanks, Dr. Smith. The next question is for Dr. Moyer, and it comes from Paul Miles with WHAS Radio. Paul says, the graph shows 542 new cases last week, the lowest weekly count since July 2020. He asks, is that correct? And do you expect the downward trend to continue, or could it spike with more people shedding masks and attending more gatherings?
542 is correct, and that is the lowest since about mid-July. Since the briefing's on Wednesday instead of earlier in the week this week, have already started to see a slight uptick in that case count. So expect it to stay steady or go up until more people get vaccinated. But we did add another 11,000 first doses last week, so I think there's a chance. But if people choose to go maskless before they are vaccinated, we will see that number go up.
Thanks, Dr. Moyer. We have two more questions in the chat, so I'd like to remind media, if you have any questions, please go ahead and place those in the chat addressed to everyone. The next question is for you, Mayor. It comes from Sinait with WHAS. She asks, how is the city helping businesses adjust to these new mask guidelines and to more crowds, especially since most of them are facing staffing challenges? And Mayor, we also have Connie Mendel on the call who can chime in as well.
Okay, I'll ask Connie to talk about kind of communication with the mask, but generally we're just saying, if a business is saying, please wear your mask, we're asking people to please wear your mask. There's a financial challenge out there with a lot of our businesses right now that it's been just a surreal year and a half or so where we were, for many businesses, the goal went to surviving because nobody had the pandemic in their business plan. So for those that are fortunate enough to have made it through, we're now the next stage is, will they be able to make it through getting all of the demand back with the customers that they had before? So just like during the pandemic, we had about $30 million worth of grants for small businesses. The Biden administration, as part of the American Rescue Plan, has restaurant relief and shuttered venue relief. So we're communicating that through our economic development department so people know how to apply for those grants as well. And then the American Rescue Plan money being available, it's $388 million. Now we're deciding the best way to spend that to get some systemic change in areas like homelessness, workforce upskilling, and several other areas of the city where we can see we're defeating the pandemic, the economy is coming back, and we're making significant change on some societal challenges that have been out there for a while. So that's how we're approaching it from a financial standpoint. Connie, would you like to comment any on about helping businesses with all the mask ambiguity right now?
Sure, thank you. So first I want to say that some of it can be confusing. When the CDC recommendations come out for those fully vaccinated people to be unmasked, we noticed across the community people were pulling off masks. I even saw a video of someone setting theirs on fire. So that was interesting. So, we're reviewing the information, we're providing educational guidance and direction. Our staff are still conducting inspections, and just as a reminder that those healthy at work guidelines and requirements are still in place. There are still some capacity limits. We just want to make sure that everyone can safely work and social distance. So those pieces are still currently in place. The other thing that we're doing is we're offering on-site vaccinations to a lot of our employers and businesses, particularly if they're located in that area of the map that Dr. Moyer showed with the least vaccination rates or the highest cases, which is basically the same areas. So we can offer those on site, or if your employees live in those areas, those are a higher priority for us. If they need interpretation or language services, all of those things. So with our healthcare partners here, U of L and Norton and Baptist and others, the Kentucky Nurses Association, all of us are working together to provide those on-site events. So you can reach us through LouVax mobile at louisvilleky.gov, and we'll put that in the chat. If you are interested in having on-site, oh, thank you, Chris. Someone visit you with vaccinations.
Thank you, Connie. Dr. Moyer, Jonathan, Spectrum News asks, what is your reaction to Jefferson County being at 38% vaccinated at this point in time?
That's a great question. I mean, I would say definitely frustrated. I mean, we have plenty of vaccine available in every zip code in the county, as well as transportation access. We have ways that you could get signed up to be homebound. We can come out to you. Connie mentioned workplaces. And so really trying to break through every barrier that might be there. And so if anybody in the community has an idea on how we can break through that and help, please, that LouVax mobile, please email us, call us. We are taking any suggestion because like I think we've heard from all of our medical partners, until we can get that number up, none of us are truly safe. So just really hoping, like, anything we can do, happy to do education events, talk to your employees, really trying to get that number up.
Let me chime in with a related question on that, Doc. Are we seeing a decrease in people getting the second dose right now? I mean, one of the concerns after the dropping of the mask were people saying, okay, we're home free right now. And at the beginning of the second dose administration, we were seeing a very high percentage of people getting their second dose. Is that trailing off at all now?
I believe it's trailing off a little bit. If you look at our data dashboard, I think by 30,000 people have gotten vaccinated in the last 3 weeks. And so that should be the only missing second doses, but we're about 80,000 difference. So hoping with the CDC's new guidelines last week that I'll encourage those who haven't gotten the second dose yet to go out and get it so they can be fully vaccinated and not have to wear their mask anymore as the guidelines continue to change.
Norton, U of L, Baptist, are you guys seeing consistent use for the second dose or a drop off?
Yeah, so we've been seeing a fairly consistent return for second doses. I think the biggest hurdle was getting people in for the first dose, but most of the time when they make the decision to get that first dose, they're coming back in for those second appointments. So we're still running at around 90 to 95%, give or take. And some of those are happening a little bit later. So that's the one thing I would remind people who do try and get it as close as we can when we're using Pfizer, for example, to 3 weeks out. We are seeing a lot of people delay that for a travel or something, particularly as we get into summer and spring vacation and things like that. Just reminders, if you've missed it, please come back in. We'll be happy to take care of you.
Okay, you want to do that within a 2-week window?
Ideally, I mean, that's ideally we do.
Okay. Chuck, are you seeing any drop off in second doses?
Similar to Jason, just a minimal drop off, but mainly later people instead of not getting it, just not getting it on time.
Mm-hmm.
Yeah, we're the same. We're just people are getting it. We're making sure we schedule the appointment when they get the first one. So we've had good buy-in. I mean, obviously you're picking out those people that are interested in being fully vaccinated because they're showing up. And so we haven't seen a drop off. There's just different reasons why people can't, as was pointed out, they're traveling, there's something happened. Maybe they got sick with something else. And so we accommodate them. We do call them just to make sure that there's not something they forgot or what have you, but we're getting a pretty good turnaround for our folks.
Excellent. Excellent. Okay, Jess, back to you.
Okay, Mayor, we have one final question in the chat, and that's from Jonathan Gregg with Spectrum News. And this one is addressed to all of our speakers on today's COVID briefing. Jonathan asks, Jonathan asks, how confident are you Kentucky can reach 70% vaccinated and when that could feasibly happen? And Dr. Moyer, we can start with you and then go to the doctors, and the mayor can close us out.
So feasibly, we could make it happen in a week. I think we have enough vaccine on hand now in Jefferson County that we could do it in a week if people are interested. How confident I am, I think we'll reach herd immunity, whether it's by people getting COVID, the disease, or getting vaccinated. I always prefer people get vaccinated because one, you have a stronger fighting power against the variants if you are exposed to the disease, and then two, you don't have all the side effects that COVID comes with. So I'm really hoping that we do reach it. But I think it's going to take a little bit of time and a lot of hard work from all of us here in Jefferson County.
I'll just add on, I think it is going to be a challenge. You heard the numbers. I think we've got, when you look at people over age 70, had a 98% buy-in to getting the vaccine, some large number like that. I think we got to let people know that it's important for them. The reason there's more buy-in in the older group is that we saw so many of them die from the disease. Well, we're still seeing people die of disease every day. If you want to know how bad it can be, you can look outside of the United States and see what happens when vast numbers of people aren't vaccinated. And I think we're just very fortunate we have the availability. As Dr. Moyer said, we have the supply. Please know that you still can get COVID, you can still get sick. I venture to guess that every one of our hospitals still has too many people that have COVID that are in the hospital, they're in the ICU, and they're still dying, as we heard the weekly total last week. Those are, what was the number, 154 people? Those are our families, they're our friends, they're our neighbors, they're human beings, and we got to do something. We got to not let our guard down. I know it's been a long year and a couple of months, but we can't let up now. This is a really important time, in my opinion.
Mm-hmm. Mm-hmm. Chuck?
Yeah, I agree with everything being said. I think we're at a crossroad, and if everybody goes maskless and don't pick up vaccines, we're going to see a bump. I think that's really going to happen. So we either need to stay on mask, and the vaccines are there. We're trying to take it to the folks. Doors are open for them to come today. I think everyone could get a vaccine at each of our spots today, and just need the community to get on board and to protect and to continue to improve the way the community's been improving.
All right. Jason, we'll give you the final word.
All right. Well, I agree with everything that's been said. I do think we've probably got a month or so or two as things start to get warmer, as people spend more time outside, where we've got the ability to take that period of time and get to 70% and protect everyone. I think that if we are still sitting in the situation we are in, once school restarts and we start to get into fall, people start moving indoors, we're going to see another big hit to the pandemic, and we're going to see that group of people that have not gotten a vaccine are going to start to get the disease in a much more rapid and aggressive fashion, because now we're dealing with the variants as opposed to the wild virus that we had previously. So I look at the fact that, can we get to 70%? We can. Depends on the community and depends on everyone trying to take care of each other as much as themselves and their families. And I think that if we take the next month or so to do that, then we have a bright future ahead of us. If we don't take it seriously, we kind of throw off all the restrictions and do not get vaccinated in the next month or so, then I think it's going to be a rough fall. I'm not going to lie. And I think I speak with all of us, is that's kind of what our hospital systems are preparing for.
Mm-hmm. Well, that's a sobering reminder about getting the vaccine, and especially as you look at India in particular and some other countries. I mean, it is like the plague, what you see about, and for us not to think that can come into our country, it will be coming to our country. So if you are, especially in some of these demographics that we know we're having challenges with, likelihood you're hanging out with people in that demographic. So as these variants get more infectious and more deadly, you are really playing Russian roulette by not getting the vaccine. So please do so for the safety of yourself and certainly those around you as well. So as a final reminder, the Community Project is still looking for volunteers. So this is a really useful way to help the city and help yourself as well. And it's fun to be part of one of these control groups or one of these experiments, so you can understand what's going on with the vaccine and the virus even more. So please consider signing up for that. And if the media would put that out, we would appreciate it. So in closing, I want to thank Dr. Joe Flynn from Norton, Dr. Jason Smith from U of L Health, Dr. Chuck Anderson from Baptist, and of course, our team at our public health department, Dr. Moyer and team, Bill Altman, Dr. Hartledge, and others. A lot of folks have contributed to the progress we're making, and we will keep on it. So look forward to seeing everybody next week. In the meantime, be well, and please get your vaccine. Thank you.
Thank you, Mayor.